Welcome back to The Line. An article in last week's Santa Fe Reporter featured a look at the shortage of doctors here in New Mexico and how the state leads the nation in the percentage of docs who are older. Almost 36% of doctors in New Mexico are 60 or older, beating that national average by more than 20%. According to the Association of American Medical Colleges, older doctors, especially in small towns, often postpone retirement until they can find replacements. That makes sense. But finding those replacements is not easy. And Dee Dee, I know for a fact, I remember your time in the legislature, this came up a lot. A lot. It was a huge difficulty. But the numbers, as I just mentioned, speak for themselves. We're not just a little bit over the national average. 20% is just a huge gap. And so meaning at some point soon, we're going to have a huge fall off of retirements. It's just going to happen. Unless we have that gap filled, we're going to be in a world of hurt. How do we get around this situation?
Well, this has been a situation that has existed for a while, and it exists around the West, in rural states. We have 32 of our 33 counties are health shortage areas. The estimate is that we will need 300 primary care docs just to keep up with the influx of patients generated through Obamacare. Wow. The thing is that we have been working on this problem. We have been working on this. It's not a new one. And there are a lot of programs that are already in place to address that. They haven't panned out yet. For example, the BA-MD program at UNM Hospital, which recruits rural kids and mentors them through the pipeline, through their bachelor's, through their medical school, and then they found these are the people that are going to go back. These are the people that don't need a Nordstrom's for their wife in order to locate there. And so, you know, there are other programs in Grant County, in Hidalgo County, to create residency programs because doctors stay wherever they are residents. And there are a lot of institutional factors that guide residents to research hospitals like UNM or other big city hospitals and don't provide them in the rural areas. So kids are being mentored and guided through a pipeline so that we will have more, not only doctors, but nurses and dentists.
Across the board. Dentists is a big one. Exactly right. Diane, it's not just about money, is it?
No, it isn't.
What's happening there?
One is that they have mentioned is the loneliness of being in a rural community with nothing much to do, and it seems to be in some ways a little more difficult to make friends. One of the things I have always said is that if we treated a physician recruit in the same way that we do a Lobo or New Mexico State top recruit, bring them in, let not only see the facility where they'll be working, but meet the community.
Right.
Have church people, have clothing people, have realtors, have people, leaders of the community, there to make them a part of the community. One of the things that they want to do we currently have a very small program where we reimburse we pay off the loans that residents have, and they commit to a 2-year residency. One of the things they want to do is extend that residency commitment so that it's 3 to 5 years. Because if you're in a community, 3 to 5 years, you've invested in the community. And we believe that that will get them to stay.
You could, Serge, you could have a couple, in 3 to 5 years, you can have a couple of kids.
Yeah.
You know what I mean? There's a lot of things that can happen in your life, and then you're wedded to that community. Does that make sense to you as well? Something like that?
Yeah, absolutely. Yeah. I think the idea of encouraging doctors to really become, and healthcare providers, all stripes, to become really embedded into community is a fantastic approach to doing this. I think one of the challenges, as we've discussed, is the lack of bright lights and glamour in some of these places, which may not appeal to young, U.S. trained doctors leaving. There is a generous source of medical professionals around the world who
J-1 visas
are interested in coming to, many rural communities around the country have relied on immigrant coming to do this through some of the visa programs we have, which are unfortunately now being
Right.
held up, stalled, not fast-tracked, whatnot. I think, it's been pretty clear that whatever homegrown solutions we're trying to find, UNM is fantastic in terms of training family medics and selecting for the family medicine program. If for whatever reason, and I don't blame these people who maybe want to go to Denver and check out what's going on up there, right?
Sure.
Or wherever. But if we can't staff that, fill that need with what we're growing here, it seems like we can maybe try to find people from elsewhere.
We need to be careful about depending on UNM. They can't graduate enough for us.
Exactly.
Or have residents graduate enough to fill all of our needs.
That's right.
Presbyterian has stated that they need over 100 primary care physicians, and that's just in Albuquerque.
So I think one of the things that we've done a poor job on in New Mexico, and this seems to be kind of a historical mode for us, is we always kind of jump out at front in a lot of things. We're one of the leading states 15 years ago in telemedicine.
Right.
Right.
We're nowhere near the top today.
That's right.
We're one of the leading states on this, going out and recruiting these high school kids, bring them into this fast track program. And then, now, I know 4 or 5 friends of mine whose kids got accepted to the program that a year in were like, I'm out. I don't want to do this. So I think that, we've got to see, we have a company right here in New Mexico called Net Medical. They have the ability through telemedicine that a person can have a stroke and that person can have a stroke in House, New Mexico. And for those of you that don't know where House, New Mexico is, that tells you how big it is. And wheel you into a doctor's office, and you are seeing the top stroke doctor in New Mexico instantaneously because of all the testing that they do. And yet we have not fully invested, in my opinion. We keep having the conversations about, well, we got to get more doctors, and we do. The problem is, we've been saying that for 20 years and they're not coming. So there's got to be an alternative. And then it gets even worse when you start talking about, we need all these family doctors, but you should talk to the people, talk to the hospital at UNM, ask them how many pediatric neurologists we have. We have none right now.
Right.
We have none.
Specialties is hurting.
And they're important specialties. Specialties where if you get, what people don't
Child
realize.
psychiatry.
Well, people don't realize that, in a
Emergency
state like New Mexico, when you have an accident in Roswell or Artesia or Dexter or House, this is where you're coming. You're not going to, you don't have 7 options like you do in LA. And when you bring in a child up here and they don't have a pediatric neurologist, it's a problem. And so I think we should be continuously looking at how to attract these folks. There's no doubt we need them. But I think we should be investing more money in technology, and we have the opportunity in figuring out a way to make it work.
Got a minute left, Dee Dee. It's come up before. I've heard this for a lot of years. Medical school's too expensive. Medical school is too difficult. All these difficulties in medical school. It should be, of course, because it's a specialized field. Is there something there for locals that we could just fill the pipeline?
Absolutely. First of all, the whole thing is a question of economic development. Each rural doctor generates $1 million for his rural community and hires 18 people. But technology is not the answer. We need the low-tech solutions because medicine is going to become a team sport where community health workers and emergency med techs and nurse practitioners are every bit as important as doctors. They're lower cost. This is going to be how we bend the cost curve overall and really meet patients' needs, which are based on social factors as well as ailments that can be treated by pills and procedures.
That's right. When we come back in a moment, we'll talk about what Albuquerque's next mayor needs to do to combat the high rate of crime here in our city.